Hi, my name is Eric Goslin. I'm the rehab manager for Chan's Home Healthcare, part of the MidCoast system. And now we're going to talk a little bit about the importance of safe patient handling. So according to OSHA, the Occupational and Safety Health Administration, statistics show that nursing assistants have the highest rate of musculoskeletal disorders in all of the U.S. occupations. While many industries are reducing their work-related injuries, both nursing assistants and allied health professionals like physical therapy, occupational therapy, and speech-language pathology are on the rise. Our goal is to keep employees happy and healthy at MidCoast. Traditionally, we've taught body mechanics by teaching people how to lift objects or people safely. For example, bending at the waist, keeping your back straight, letting your legs do the work, pushing rather than pulling objects, and trying to avoid awkward positions. Newer research is now showing that the most effective way to reduce workplace injuries related to lifting is to avoid heavy lifting altogether. By using appropriate equipment and other devices like canes, walkers, the Hoyer, with patient transfers, we can have a safe patient handling environment. This is why at MidCoast we support the ideal that manual lifting of patients should be minimized in all cases and eliminated when feasible. Please remember, there is no such thing as safe manual lifting of a patient like picking someone up off the floor. Key aspects of safe patient handling. Patients should be active participants when possible to assist in transfers and their care. Handling aids must be used to minimize risk to patients and employees, which may include gait belts, walkers, slide boards. If a patient cannot do the majority of the work, then even with handling aids, then the employee should use the appropriate equipment for the transfer. For example, a patient may not be able to do a stand pivot transfer using a walker and employee assistance, but they can do the majority of the work with a slide board transfer. This would be a much more independent way for the patient to transfer and safer for both the patient and employee. Again, manual lifting of patients should be eliminated when feasible. So, what this does not mean is that healthcare providers will never transfer or reposition a patient manually. But planning for safe patient transfers should be based on patients' physical, cognitive, as well as emotional status and their medical condition. Equipment has been provided and maintained with management's commitment to minimize manual lifting of patients. You should reach out to managers and team leaders if you're not completely familiar or trained in the equipment we're using on the floor or the handling aids. You should also reach out to management if more equipment is needed, making sure that we have a safe patient handling environment. For example, the Senior Health Center bought an extra Hoyer lift so that units would not have to share between, and it made sure that there was enough equipment available for the staff at all times. MidCoast culture of safety includes a collective attitude of employees at all levels taking a shared responsibility for safety and in the work environment. By doing this, we can provide a safe environment for both patients and employees. We may all agree that handling aids and/or equipment is safer, but there are some realistic barriers that have been identified in the research. For example, patients that don't like or trust the equipment that isn't user-friendly, location and availability of the equipment, i.e. you can't find it when you need it, time constraints, lack of employee training of equipment, space restrictions, particularly with larger pieces of equipment. Let's say the Hoyer just isn't going to fit in that spot in the room that it's needed. Weight limitations barring the use with appropriate patients. Even with known barriers, if we can work together to emphasize limiting manual lifting of patients when feasible and focus on safe patient handling, the benefits are worth it. It has proven to decrease falls and pressure ulcers of patients in our care. It would be improved quality of care, fostering patient independence and safety, increased patient satisfaction and comfort with well-trained staff evaluating their needs, and lastly, it's a more satisfying work environment due to reduced employee injuries and job-related stress. Again, the goal is to keep employees happy and healthy at MidCoast. In closing, if you think you've suffered a work injury or have work-related pain, the right course of action is to contact your manager directly. He or she will work with employee health and yourself to make sure things are addressed. Research has shown that acute injuries are much more manageable when identified early and treated early. Remember, we want to keep you happy and healthy at MidCoast. Thank you for your time today.